We've had a rich and wonderful day of informative and inspiring conversations. And I know that beginning from this morning with Dr. Bullard, to our two panel morning sessions, to the panel that just recently concluded, as well as our luncheon panel, we have a lot of information that we've received, but most importantly, we've been able to connect with friends and colleagues to continue this work far beyond just this day. And to really provide us with a closing keynote that really captures the very essence of our gathering today, I'm delighted to introduce Dean Dayna Bowen Matthew to you, if you have not met Dean Matthew. But most importantly, I think Dean Matthew brings a particular lens that brings together our shared concerns around faith, health, and the environment in a unique way. And her scholarship, as well as her leadership, has been instrumental not only in the academy, but also in our society. In the afterword to her bold book, Just Health, Treating Structural Racism to Heal America, Dayna Bowen Matthew challenges us all, writing, "I am compelled to observe that structural inequality must be dismantled even more broadly than along the racial lines that have been the subject of this book. All of us must recreate our social order to equally value and protect the sacredness of every human life. With clarity and moral courage, Dayna Bowen Matthew reminds us that the pursuit of health justice is nothing less than a collective reimagining of who we are and who we aspire to be. As a scholar, advocate, and public servant, she stands at the forefront of this work, illuminating a path toward a more equitable, humane, and life-affirming society. Dean and Harold H. Greene Professor of Law at George Washington University Law School, Dayna Bowen Matthew is a national leader in public health and civil rights law who focuses on disparities in health care, and the social determinants of health. In addition to Just Health, Treating Structural Racism to Heal America, she is also author of the best-selling Just Medicine, A Cure for Racial Inequality in American Healthcare. She previously served on the faculty of the University of Virginia School of Law, where she was co-founder and inaugural director of the Equity Center, now known as the Center for Community Partnerships, which is now a transdisciplinary research center that seeks to build better relationships between UVA and the Charlottesville community through community-engaged scholarship that tangibly readdresses racial and socioeconomic inequality. Earlier in her career, Dean Matthew served on the University of Colorado Law faculty as a professor, vice dean, and associate dean of academic affairs. She was a member of the Center for Bioethics and Humanities on the Anschutz Medical Campus. Dean Matthew held a joint appointment at the Colorado School of Public Health. She has also taken on many public policy roles. In 2013, she co-founded the Colorado Health Equity Project, a medical legal partnership incubator aimed at removing barriers to good health for low-income clients by providing legal representation, research, and policy advocacy. In 2015, she served as the senior advisor to the director of the Office of Civil Rights for the U.S. Environmental Protection Agency, where she expedited cases on behalf of historically vulnerable communities besieged by pollution. She then became a member of the health policy team for U.S. Senator Debbie Stabenow of Michigan and worked on public health issues. During the 2015-2016 year, she was a Robert Wood Johnson Foundation Health Policy Fellow in Residence in Washington, D.C., and pivoted her work toward population-level clients. She forged relationships with influential policy groups such as the Brookings Institution, where she is currently a non-resident senior fellow, and the Congressional Black Caucus Foundation. She is also a member of the American Law Institute and currently serves on several public health boards across the nation. Before entering academia, Dean Matthew practiced as a civil litigator both in Kentucky and in Virginia, where her work primarily focused on the defense of medical care providers and corporate manufacturers in state courts, federal courts, and before administrative and licensing tribunals. Dean Matthew earned her AB in economics from Harvard, a JD from UVA, and following her graduation from the University of Virginia, she clerked for Justice John Charles Thomas, the first African-American justice to sit on the Virginia Supreme Court. She received her PhD in health and behavioral sciences from the University of Colorado at Denver. Please join me in welcoming our afternoon keynote speaker, Dr. Dayna Bowen Matthew.
Wow, I'm going to try and live up to that amazing introduction. Thank you so much, Dean Walker. I have to say, I sat there and I thought, girl, you're getting old. Because that was just, it's been a really humbling experience to be here today. I honestly pray that I will have something to inspire you for the end of the day, because the people who have already spoken and the people who are in the audience have so much knowledge and so much experience that, as I said, I'm very humbled to be able to stand before you today. It's also quite an honor to be here in the name of the amazing John W. Hatch, Dr. Hatch's legacy. I spent some time last night watching some video of him and of your prior speakers, and I thought, oh, I'm going to need a lot of prayer to try and live up to what has gone before. But I'm honored. I'm honored to talk about 5 things today. I'm going to talk about what justice demands of health. I'm not going to spend a lot of time on it because you know that we have a very unjust health system. You've already heard about the injustices in the environment, so I'll speed through those. I'll pause for a second and take you to law school and talk a little bit about justice itself. I'm afraid my message is not very encouraging here. I'm going to talk about the fact that justice is not always just. The government's not always just. The courts are not always just. The agencies are not always just. But we'll talk about justice and we'll land on faith. So I took a little bit of liberty and moved things around because I think what justice demands ultimately is a whole lot of faith from us. So I have no deeper message than to say that a society is only as healthy as it is a just society. Justice is the only thing that can make a society healthy, and to the extent that a society is unjust, it is also unhealthy. So when you see great health disparities, as you see in North Carolina, as you see around the country, all you are seeing is evidence of injustice, evidence of the fact that there are disparate treatments for all of the social determinants of health. And you know these data. I picked them up because 2024 might be the last year that you get to see a report like this for a little while, right? And we've already learned from the great Dr. Bullard that what this means in Colorado as well as around the country is we get more of the bad stuff and less of the good stuff, right? So I'm not going to recount that data. You can have my slides. You already know it. But these are evidences that individual health disparities translate up into environmental or community population level health disparities. Now, if you are at all familiar with my writing, you know my parents, who I always honor in anything that I say, because both of them died at an age younger than I am right now, and you better assume that's very young. They are in this picture 47 and 48. My father 48, my mother 47, and in the year after this picture was taken, my father is dead. Now, that's not remarkable. He was a remarkable man, but that's not remarkable for the community from which I came. I grew up in the South Bronx, where the structural inequality of our low wages, right, of the air that we breathe that was asthma infested, right, of the water that we drank, of the residential segregation that meant that the only way I could stand before you today is if my parents got me out of the South Bronx school system and moved me into a school system 7 miles away where I could go to college, so I could go to Harvard, right? In order to do that, between the two of them, they worked 6 jobs between the two of them. And I'm going to tell you, that was not unusual in my community, because no single one of those jobs paid a living wage. My father died at 49, right? So how did he die at 49? Well, he'd get up in the morning and he'd go to work as a banker. If you know New York City, 42nd Street Bowery Savings Bank, he was a residential real estate appraiser. And so he'd ride the number 6 train down to 42nd Street, and he'd do a day's worth of work, come back. And I was so proud because he was the only father in my neighborhood that would walk home in a suit. My mother would have dinner ready for him, and then he'd take a 3-hour nap before he went back and drove the same subway that he had worked on, that he had rode to his first job on. And then he had little jobs being a superintendent. He coached a basketball team. My mother sold clothes out of the car, all of these things, right? And if you do that long enough, you die at 49. There's no big mystery about this, right? By the time that I went to high school, I lived in a food desert. And again, I only tell my story because it is exemplary. It is not extraordinary. It is just exemplary, right? And all it does is prove that where you sit on the plane matters, right? So everybody has seen that movie, Sully, where the plane goes down on the Hudson River and there are 155 lives on board. Well, you see in this picture the plane sitting on the Hudson River, and you see there are 2 groups of people on that plane, right? The back group of people are the standing on the wing people, and they're sinking, right? The Hudson River in January is lapping up around their ankles. The people in the front of the plane are in a life raft. They have they have life jackets. They have flares to call for help, right? They have some victuals, right? Some rations, so they don't have to eat each other if they're out there too long, right? But where you sit on the plane matters. That's all I'm telling you. Where my parents sat on the plane was not a good draw. They did not draw a great location. And as a result, they died early. This is called structural inequality. I'm not going to spend a lot of time, as I said, you guys know this, right? But you know that the Gini index, which is a measure, not just of wealth, but of wealth disparities, right? The highest quintile of earners as compared to the lowest quintile of earners will generate an index. And when you look at all the nations that are listed on the bottom, all the way over at the tall end is the United States, green where the arrow is. We have the greatest income disparity, except for South Africa, Costa Rica, Chile, Mexico, Bulgaria, and Turkey, right? And we therefore also have the worst health outcomes, right? This is structural inequality. It simply means that inequality will predict over and over and over again your social and your health outcomes. Because look at this, if you look at income equality, low to high on the x-axis, and social outcomes, better on the bottom, worse on the top, what you see is the United States is in the upper right-hand corner. Worse health outcomes because of highest income inequality. Now, those of you who are sociologists, we could spend a lot of time on this because it's not just absolute income. It is income inequality, right, that you see is correlated with these health outcomes. Now, we've seen this in all kinds of manifestations. I'm just going to show a few again. Environmental injustice, right? So you remember all of these data from the COVID-19 outcome, right? Where racialized outcomes in death, in cases, in hospitalizations were inverse to access to vaccinations, right? So the people who were dying the most had the fewest access, had the least access to vaccinations, right? But let's layer the environment on top of that, because you remember, I'm sure, that during the time that we were talking about these disparities in COVID, people were saying, oh, but comorbidities were the reason, right? comorbidities, the people who were dying, it wasn't because of their race, it was because they had preconditions like diabetes, right? They had other even the disparities in those comorbidities didn't seem to clearly predict. They just didn't seem to pick up the fact that, for example, if you were living in a neighborhood like I grew up in, Asthma Alley in the South Bronx, and you were breathing dirty air, you were more likely to have PM 2.5 penetrate your lungs, and therefore you were more susceptible to death by COVID, right? So it's not just my comorbidities, it's where I live, where I work, where I play, where I worship. My environment was killing me, right? That's what made me more susceptible, because those particles I was breathing them long before I was exposed to COVID-19. Now, this is also true locally. Let's bring it to North Carolina. This is just an example, and if you follow map after map, I'm going to do about 4 maps, right? So Charlotte, Mecklenburg County. This map is showing where there are pollution sources in Charlotte, Mecklenburg County, right? Now, if I were to link onto the EPA interactive map, the EJ tool that produced this, what you will find is that map is no longer available, right? So you can't use that tool anymore. So I'm trying to capture as many of these as I can because they're disappearing faster than cotton candy in the summertime, right? So this is a map of pollution sources. So let's just orient ourselves, right? The southeast has fewer, the northeast has fewer, and the west side of Charlotte has more pollution, right? As a result, the case rate for COVID-19 deaths and hospitalizations, higher in the west, lower in the south, lower in the very north, right? You just put one after another of these maps on top of one another, right? Why did my parents work 6 jobs? So that I could go to school. They wanted to send me to school. So why did they have to do that? Because the schools in my neighborhood would have shown the kind of education gaps that you see in Charlotte, Mecklenburg County, right? This shows in the north the percentage decrease by zip code of proficiency in reading and math is very high in the north and low in the west, same place where the pollution was, right? The only 2 schools in Charlotte, Mecklenburg County that have high school proficiency reading rates above 65% are where? In the south, right? Only 2 schools in the entire county, right? So my parents' story is being replicated all over North Carolina, I dare say all over the country, right? My parents' story is being replicated. And I'm just going to do this last one because Dr. Bullitt inspired me about maps, right? You can look at income, dark, race, red is a D for the school, schools get a D if they're red, green if they're an A or B school, right? And race, I have to tell you, my labels are switched. I'm sorry about that. The left side should say race, right, where there is in the dark a higher percentage of minority populations, and the right side should say income. I've got those 2 switched. Are you with me? Okay. So income is lowest where the minority concentration is the highest, right? None of these are stories about the environment that are new to you, right? But let's just really let it sink in for where we are. I'm going to pause here and give you a definition of structural racism. I have to credit Dr. Kamara Jones with this. But she is the one that taught me that structural racism does 2 things very, very efficiently. Number 1, it orders people hierarchically. You are of a higher value if you are in one category and a lower value if you are in another category, right? So it hierarchically orders people from high superior to low inferior. And then number 2, it allocates power and all the resources according to that hierarchy. That's what structural racism does. Tells you where you belong on the hierarchy, and then it tells you what you get as a result of where you belong. And that's the structural racism that I contend was responsible for making my children unable to inherit the wealth of grandparents. That's what I contend structural racism has done in my family. All right, so we've talked about individual health, we've talked about environment. Let's talk about justice for a little bit. So all of you have seen this, that what determines your health is not nearly as impacted by your access to clinical care. It's not nearly as impacted by your biology or your genetics, but it is that large blue pie slice that talks about where you work, where you live, where you play, and where you worship, your social and economic factors. Now, I will also argue pretty hard that it's also true that your health behaviors are affected by where you live, by where you work, and where you play. But all of that is characterized by unjust discrimination. If you think about every single one of the social determinants of health, whether it's housing, education, transportation, whether it's what kind of air you breathe, what kind of water you drink, whether it's recreational spaces, all of this is distributed unjustly. And that's why civil rights law is so important, or has been historically important, in righting those wrongs. But don't get too excited, right? I got into the law because I was post-Brown versus Board of Education. I'm going to tell you that this is what I thought was going to save the day, the law, right? We are going to need law, no question. We are going to need law in order to right this unjust distribution of all the social determinants of health. But let me just tell you, equal justice under the law isn't always the case. Everybody knows that the 13th Amendment is purported to have liberated enslaved people. But do you know that the original 13th Amendment would have done the exact opposite? Would have done the exact opposite. It would have been, this is called the Corwin Amendment, it would have been the 13th Amendment to the Constitution that made an unamendable, permanent amendment to ensconce slavery in our Constitution. And if this was just a historical fact, I really would not be wasting your time with it. But it turns out that this version of the 13th Amendment that says, no amendment shall be made to the Constitution which will authorize or give Congress the power to abolish or interfere with slavery, right? That's the opposite of the one we got, right? This passed both houses of Congress in 1860 with a 2/3 vote. This went on to ratification. 6 states had ratified it, and the only reason we don't know the outcome of the story is because someone fired on Fort Sumter and the Civil War began, right? So I just want you to know that from the start, this notion of equality was something of ambivalence in the United States Constitution, right? We weren't too sure we wanted y'all free. We weren't too sure we wanted y'all equal. It just happened to be that this was not the version of the 13th Amendment that passed. Okay, so if you know that, then you also need to know that the great emancipator, who, I'll give him his due, great movie, Lincoln, but the fact of the matter is that he spoke of this first version of the 13th Amendment with approbation in his second inaugural address. He said, I have no objection to that one. Do you see what I'm saying to you? That the commitment to justice under the law waxes and wanes, right? So we cannot rely on just law and government to tell us what to do. The Equal Protection Clause, I know that's what we're fighting for, and I say use it. Don't get me wrong, we must use it. We must use the 14th Amendment that tells us that no state can deny the benefits of law or equal protection of the law. We have to use it. We have to try and return to that very brief 12-year period where we got serious as a country about equality. Reconstruction, the first Reconstruction, right? We have to try and return to that. I'm not saying to lose hope. We have to try and recreate these kinds of scenes, right? right? We saw Dr. Bullard cheering for the executive order. We have to try and recreate these scenes. Do not get me wrong. We have to litigate, right? The only reason that we desegregated hospitals was because 3 dentists, 2 doctors, and 3 patients sued in Greensboro, North Carolina, right? The Moses H. Cone Memorial Hospital is the case that was responsible for desegregating hospitals all over the United States. The law works sometimes, but it doesn't always work. It doesn't always work. And I'm trying to give you a message of hope. That was not supposed to be funny. I'm trying to say to you, don't lose hope just because it looks like things are going the wrong way. They've gone the wrong way before. The court has been wrong. The Supreme Court has been as wrong as it's been right, right? So when we can use it, we use it. But SFFA, the anti-affirmative action decision, they got it wrong, right? We can't stop fighting because the Supreme Court is wrong. They've been wrong before, right? I'm not even going to spend time on this one. I can't, right? I will tell you that my sister girl from the South Bronx, if you have time, read Justice Sotomayor's dissent from that case. She threw down. And what she did was basically tell you what the 14th Amendment is supposed to say. I'm going to focus for a little bit on Justice Jackson's opinion, just to show you, if you have an opportunity, I could have tears in my eyes as I tell you this. If you have an opportunity, go watch an argument at the Supreme Court and see how this woman is fighting. See how Justice Sotomayor is fighting, right? See how Elena Kagan is fighting. They have not given up hope. They are writing dissents like this one. I want to just share this one with you for a minute. The law has been wrong. Justice Jackson, in her dissent, tells you all the ways in which the law has been wrong, right? You can read that at your leisure later. And then it tells you that even though the law stopped being wrong on its face, having segregation as its express objective, it became facially neutral and still was doing the dirty deed of segregation, right? And so she goes through her dissent and explains that history, right? But wait. And then she says, let me tell you what the effect of those laws are. And she basically takes us to school using legal epidemiology, right? She basically takes all of the health data and ties it to the law. The education system that used to be equalized by affirmative action, she says is going to be destroyed, and the outcome will be an exacerbation of health. She takes us basically to public health school. That's what she does. She tells us about Black and Latino children and their heart rates and infant mortality, and all of this isn't a judicial decision about affirmative action. She gets it. She gets it. She understands that big blue slice of the pie, social and economic conditions that ultimately affect health. She understands that. And so she talks about wealth gaps, she talks about education gaps, and she just does a beautiful job. But let me just say, the Supreme Court has been wrong as often as it has been right. Korematsu sent people to Japanese people to internment camps. Right? Dred Scott told us we weren't citizens if we were African Americans. Plessy versus Ferguson. See, I'm a child after the Brown versus Board of Education decision, so I'm all happy, happy, happy. That reversal of Plessy versus Ferguson, which ensconced separate but equal, lasted for 60 years. 60 years before Brown came and reversed it. Don't lose hope is what I'm trying to say. The government is not always just. The government is not just unjust because of scenes like this one. If you are paying attention now, you know that the USDA has stopped collecting data. They don't publish the state of hunger anymore. If you can't see it, you can't fix it. Schools are discontinuing their funding programs for after-school programs and school lunches. The Indian Health Service was subject to shutting down many of the special needs programs, right? The government's not always just, and it's not going to save us. We can't rely on one tool in the arsenal. And the EPA, Lord Jesus, don't get me started on the EPA. I only spent 1 year at the EPA, but they have stepped so completely back from their charge The Biden administration finally reduced the particle matter of PM 2.5 particle matter thresholds from 12 microns to 9 microns, and it's now been reversed. My friend Vernice Miller told me this morning. She writes in her WEAC newsletter. Right? So things aren't going well at the government level. Things aren't going well in the courthouse. But don't lose faith. Don't lose faith. That's what I love about this conference, that we are asking what our faith demands of us. And I mean that from every faith tradition. Every faith tradition demands justice. My faith tradition, it's one of my favorite verses. This is what the Lord requires of you, to do justice. That's what he asks you to do. That's your job. Your job is to do justice, right? The word justice in the Old Testament is often translated righteousness. Now, I'm not a preacher, I'm not a scholar or theologian, but I do know you can't be righteous without being just. So I'm gonna, okay, Dr. Bullard said he's got tenure, so he didn't mind. I have a plane ticket, so I don't mind. Getting myself in just a little bit of trouble, I'm gonna tell you this. You're not gonna invite me back. I am sick to death of the evangelical white right capturing and owning the conversation about what religion requires. We need to stop. We need to stop letting them have that ground. They don't own it. They are as confused as the Pharisees were that hung Jesus, I'm sorry. Because it was the church that stood up against PCBs in Warren County. It was the church that organized, right? What does justice demand of you? It demands, what does your faith demand of you? It demands that you do justice. It demands that you see the image of God in the person who is standing across from you, no matter what their creed, color, anything. You have to see the image of God in me sees the image of God in you. It was the church that laid down in front of those trucks to keep them from dropping PCBs. And it should be the church again today. It should be people of faith, because the moral mandate doesn't change based on who's in office or who's sitting on the Supreme Court or which agencies are doing what with data. It does not change. The moral mandate to do justice is what we can. It was the church, the United Church of Christ, that published this groundbreaking report, Toxic Waste and Race, and republished it 10 years after and 20 years after, showing us the correlation between race as the determinant factor, not socioeconomic status, not poverty, not wealth, but race. It was the church that did this, and 43 years later, it's young members of churches that are marching still. And we need to join them and support us. So what does justice demand of us? It demands that we do our own research, because nobody's doing it for us anymore, right? I think it was Ben Chavis that said, I got the Church of Christ to spend $250,000 to do that toxic waste and race report. Again, my friend Vernice Miller said, her grandmother said, you spent $250,000 to find out what we could have told you. But if you can't see it, you can't fix it, right? So we have to do our own research. We have to educate one another, just like we've been doing all day today. We have to eventually turn our education and our research into action. Last night when I got to my hotel room, I didn't feel so well, but I did stay up and read Faith for Tomorrow. And I'm quoting here Bill Leonard on the opening of this great divinity school, where he said, sooner or later, all good instruction involves provocation. I love that. Sooner or later, you got to do something with what you've learned. You've got to stir up some change. You've got to get out and make a difference. And so what's pressing? Wake, divinity, beyond our certainty, beyond ourselves. What's demanding more of us? I think we close by asking ourselves that very question. What are we asked to do? We must organize. We have to participate with communities and find out what they need. We have to do our own research, come forward with our own recommendations, and then fight like hell to make somebody act on it. You're going to win some, you're going to lose some. You have to advocate. North Carolina's research triangle, I just did a little bit of research. You guys got all kinds of agencies here. You all could be marching on them and sending them letters and closing them down. And you vote. We should collaborate, just like the Faith Compass Center does with communities. I'm going to speak on the immigrant community for a second because if you're doing justice and you're paying attention, there are more scriptures in the Old and New Testament about treating foreigners with respect. And treating foreigners with respect is not what's going on here right now. So when the government steps back the way it has stepped back, we have to step up for the immigrant communities. They're the ones out in the agricultural fields exposed to pesticides. They're the ones at the CAFOs, right? And we can't divide. We can't divide. We have to consider the image of God in us is the image of God in others, and the churches should be at the forefront. So what justice demands is that we never give up hope. We never stop fighting. I'll leave you with this picture in the gallery of one of my favorite museums in the Washington, D.C. area. I was born in New York. As I said, I'm a transplant to Washington, D.C., and one of my favorite galleries is this place called the National Portrait Gallery. And there's an exhibit, a standing exhibit there called The Struggle for Justice. It's not always out, but sometimes there's an 8x10 photo. And it's taken from the vantage point, like if I'm standing here, and when Dean Walker was miking me, it's taken from a photo, the camera's back here. So you would see the back of the speaker's head, and you'd see members of the audience, right? And the speaker's getting mic'd, and it's a Baptist church. Why? Because I grew up at Baptist church. I saw all the signals. I saw the white Jesus on the wall. I saw everything. I saw everything from the Baptist church, right? In the front row, there's a woman who's got a domestic uniform on, and her apron is stained, and she's tired. You can tell. It must be like a Wednesday or a Thursday night. There are people with overalls on, a lunch pail. It is just ordinary people sitting in the audience. And it is not until you read the caption and you find out the speaker is Martin Luther King Jr., and the woman in the domestic uniform is Rosa Parks. Otherwise, you wouldn't know. And the reason I close with that story is because it was just a Thursday or a Friday night at church, and they did not give up hope. They were working for the change that has made it possible for us to be where we are today. And so I ask us, what does justice demand of us? It demands no less. Thank you.